Medurstand. Understanding medicine.
Professor Aziz or Rehman from Medurstand. Today we are going to start the examination of a respiratory system. Now, if somebody has cyanosis, you would specifically see if it is central or peripheral cyanosis. In central cyanosis, the lips will be cyanosed, and if you ask a patient to open the mouth and examine the tongue, open your mouth please, this will be cyanosed, upar ka nisban. This part will be particularly cyanosed. So, presence of blue discoloration in central part, which is represented by oral cavity, lips and tongue, they will be blue. So, central cyanosis will indicate a central disease process, either a right to left shunt like Fallot's tetralogy or an advanced lung disease. For cardiac shunt, you need to have a right to left shunt, either primary shunt like in Fallot's tetralogy or a reverse shunt like in Eisenmenger complex. But in any lung disease, whether it may be emphysema or pneumothorax or asthma or large pleural effusion or pneumothorax, whatever, any advanced lung disease can cause central cyanosis. Then occasionally methemoglobinemia can also cause central cyanosis. How to differentiate between central cyanosis and peripheral cyanosis is basically to see where the cyanosis is present. In central cyanosis, cyanosis will be present in the central part as well as in the peripheries, whereas peripheral cyanosis will be present only in the peripheries. Another difference is if we do arterial blood gases. Now this is important to understand the mechanism of cyanosis. If we take blood sample from here, from the radial artery, and do blood gases, in central cyanosis this would show reduced oxygen, whereas in peripheral cyanosis this blood will show normal oxygen. Why? Because in peripheral cyanosis it is the greater extraction of oxygen in the capillaries. The blood in the radial artery has normal oxygen. So that is how we differentiate between central and peripheral cyanosis on the basis of arterial blood gases. So if it is central, it is either right to left shunt or primary lung disease. How to differentiate between the two? Basically based on cardiac and respiratory finding. But another way is if you give oxygen, to the patient, and after some, if cyanosis does not improve at all, that would suggest a right to left shunt. Why? Because in right to left shunt, blood never goes to the lung. So it never goes to the lung, it never gets oxygenators. So even if you give 100% oxygenation, there will be no improvement. Whereas in lung diseases, there will be some improvement. And that will also be shown on the improvement in arterial blood gases. So this is very, very basic account of cyanosis. In methemoglobinemia, there is no cardiac disease, there is no respiratory disease, and the pattern is exactly that of deep central cyanosis. Now you may take history, there may be history of some poisoning, or you may send blood for specific examination, and that examination would determine the presence of abnormal hemoglobin or some toxin responsible for this cyanosis. Thank you.